8 warning signs and symptoms of colon or bowel cancer. Colon cancer is also known as colorectal cancer, bowel cancer, or rectal cancer. It is the third most common type of cancer for both men and women. Colorectal cancer starts when tumors or polyps develop in the lining of the colon, or the end part of large intestine, which is called the rectum. The tumors and polyps, when not removed earlier, can grow over time, then become cancerous, and spread in the other parts of body. The good news is colon cancer is treatable and curable, especially if diagnosed early. Nearly everyone survives bowel cancer, if diagnosed at the earliest stage. Colon or rectal cancers do not usually produce symptoms in the early stages of disease. As the tumor grows, symptoms will depend on the location of the primary tumor within the intestine. However, patients with colon cancer or rectal cancer may experience one or multiple symptoms. In today's video, we are going to talk about 8 warning signs and symptoms of colon or bowel cancer. Just a quick reminder, this video is for educational and informational purposes only, and is no substitute for professional medical advice, diagnosis, or treatment. If you find the video informative and helpful, like and share it with your loved ones to protect their health. And don't forget to click the subscribe button and hit the bell to stay updated on new videos. Let's get started. 1. Blood in the stool. You may notice obvious blood in the stool, or darker colored bowel movements, which may indicate that there is bleeding within the intestinal tract or rectum. Sometimes bleeding may be present but not visible, and may not be discovered until a blood test indicates a low red blood cell count. While blood in your stool can be caused by other conditions like hemorrhoids or anal fissures, it's important to consult with a doctor to rule out any serious underlying causes. 2. Rectal bleeding. Bright red blood in the stool typically indicates that there is bleeding in the rectum or colon, which may be a sign of colon or rectal cancer. Rectal bleeding can also be caused by hemorrhoids. Typically, patients with hemorrhoids experience symptoms that come and go with flare-ups, whereas rectal bleeding caused by cancer usually continues or worsens, and is more likely to be accompanied by pain. 3. Changes in bowel habits. If you're experiencing persistent changes in your bowel movements, this could be an early warning sign of colon cancer. Changes in bowel habits that can indicate colon or rectal cancer include new-onset constipation or diarrhea, changes in frequency or size of bowel movements, a bowel that doesn't seem to empty completely, stool that is narrower than normal, even as thin as a pencil. Occasional bowel changes can be caused by a dietary change, disagreeable food, or a viral or bacterial infection. However, if you are experiencing something new and unexplained that lasts more than a couple of days, see your doctor to determine the underlying cause. 4. Abdominal pain and bloating. When cancerous tumors grow in the colon, they can obstruct the intestines and cause a buildup of gas and waste. This can lead to stomach bloating, distension, cramps, or pain in the abdominal or bowel region. Abdominal pain is a common symptom of many different conditions, including diet-related gastrointestinal distress, Crohn's disease, or ulcerative colitis. But it can also be an early warning sign of colon or rectal cancer. See your doctor if you experience frequent abdominal pain and bloating that does not have an obvious cause. 5. Nausea and vomiting. Nausea and vomiting can occur if a colon or rectal tumor is obstructing the bowel and inhibiting the passage of liquid or solid waste or gas. Bowel blockage can also be accompanied by painful abdominal cramps, bloating, and constipation. Nausea and vomiting are symptoms of a range of conditions, which may be benign or serious. If you experience persistent nausea and vomiting, along with other signs and symptoms, it's important to see a doctor to potentially rule out colon cancer. 6. Anemia. Anemia is a blood disorder characterized by a deficiency of red blood cells or hemoglobin. These cells are responsible for carrying oxygen to the body's tissues. In patients with colon or rectal cancer, intestinal bleeding can occur without any noticeable bleeding from the rectum or stool. This may lead to anemia. Common symptoms of anemia include paler skin, increased heart rate, fatigue, dizziness, shortness of breath and light headache. If you experience the symptoms of anemia, especially accompanied by other symptoms of colon cancer, consult with a doctor for further testing. 7. Loss of appetite and unexplained weight loss. Loss of appetite and unexplained weight loss are possible signs of colon or rectal cancer, along with many other unrelated conditions. In patients with colon or rectal cancer, these symptoms are usually related. Cancer cells can release substances that alter how your body processes food, leading to a loss of appetite. Stomach pain and nausea can also reduce appetite, so you don't consume enough food to maintain your weight. Persistent diarrhea, loss of appetite and difficulty digesting and absorbing nutrients can cause weight loss. Speak to your doctor if you experience loss of appetite and unexplained weight loss that do not have an obvious cause. 8. Pelvic pain. Pain in the pelvic area is not common in patients with colon or rectal cancer. If it occurs, it may indicate that the cancer has spread to the pelvic area. This is a serious complication that requires immediate medical attention. Therefore, it's especially important to be aware of the symptoms if you've had intestinal issues in the past. There you have it, 8 warning signs and symptoms of colon or rectal cancer. Again, if you experience any of these symptoms, please make an appointment with your doctor to get checked out. Remember that an early diagnosis can lead to more successful treatment options. I hope you found the video helpful. Thanks for watching, and I wish you a healthy and happy day.